Another week, another COVID variant making the news, and lots of talk about boosters yet again. Joining us all to sort this out is Dr. Bill Hartman, principal investigator for UW Health Pediatric Moderna vaccine trial. Thank you so much, Doctor, for being with us. Here we go again. There's a new variant, this Omicron XE. Should we be concerned about this?
So it's a variant that we should be keeping our eye on because it's called a recombinant variant, meaning it's a combination of both Omicron and the BA2 variant, which has a much increased ability to be contagious, to infect people, 80% more than just Omicron itself. And so the combination of the two, we don't really know how infectious it is, how sick it will make people. But it's something that we have to keep an eye on, and especially in the UK where they found this variant, I think we'll keep our eyes and ears to see what they find and how that is going to affect things here at all.
For people who are double vaccinated, who are boosted, and who have been, in relatively good health, except for those who are compromised, should we be worried about this?
Well, I think for anybody that gets infected with COVID, the fact that you have the vaccine and the booster on board already primes your immune system so it's able to attack that virus and stop it in its tracks. Having that immunity on board to fight that virus is really an important layer of protection, especially right now where we don't have monoclonal antibody treatments that are effective against Omicron, and our ability to treat the virus in people who come into the hospital is somewhat diminished because of that. And so the fact that we have the variants that are arising from Omicron, it's something that we should be aware of, but as long as we've got the immunity and the ability to fight that variant, I think we'll be in good shape.
The federal mask requirement for public transportation, buses, planes, etc., expires on April 18th. Will it be extended? Do you think it should be extended at this point?
Will it be extended? I don't know. My gut feeling is that it probably will not at this point. However, for people who are immune compromised, I certainly think wearing that mask is still an important layer of protection when they are in enclosed spaces. For the rest of us, the CDC estimates that about 95% of people in the United States have some level of immunity against COVID right now. And so the fact that we're at this level of community immunity really puts us in a good place, and going without the masks right now, while it's a test on our vaccination system, I think we're in a good place.
And in fact, some Wisconsin counties have actually moved up in terms of positivity rates. Just when we think this thing is going down, so to speak, it's still important out there, that the hand washing, the masking, you're basically underscoring the importance of doing all that. What about the kids? The kids are going to be getting out of school. They're going to be going to events. How do you feel about that? For example, summer camp.
Well, I think overall in the United States, we have to do a better job of making sure that we vaccinate our children for the greater community so that when they do get together, they're in as safe a place as possible. That being said, the youngest kids, we still don't have approval for or an EUA for the vaccine. And so we have to continue to make sure that we push the FDA, that we get the data to them from trials such as the one we run here with Moderna, so that they can make that decision, make that call on whether those youngest kids can get vaccinated.
All right. Well, Dr. Bill Hartman, we always appreciate your insight, and we're certainly not done with this topic, so we'll be seeing you again. Thank you for your time this afternoon.